Okay, let's talk about injuries to a meniscus of the knee. I'd like to start out by showing you some of the simple anatomy of the knee on this wall chart. Let's start out first with the bones. Now, there are two leg bones. This bone here is the tibia, and the bone to the outside of the knee, which is more narrow here, is called the fibula. The thigh bone that also is involved with the knee is very large. It's up here, and it is called the femur. Now, what you don't see in this view is you don't see the kneecap, but it is situated right here, and it is called the patella. The reason you don't see it is it's removed so that we can look at the structures that are deeper to the patella, specifically the meniscus. Let's look at the menisci. This is the medial meniscus, the meniscus that is at the inside part of your knee, and this is the lateral meniscus, the meniscus that is at the outside part of your knee. These menisci are C-shaped rings of cartilage. And how does a meniscus problem feel? Well, you're going to have increased pain sometimes with running, cutting, pivoting, or climbing or descending stairs. Also, your knee might give way or it might lock up on you and you won't be able to move it for a time. Meniscus injuries are especially painful with rotation or pivoting. Now let's look at another view of the meniscus. We'll look at it from above, and so we can see the meniscus from the top. Now, here you can see the two meniscus cartilages. This is the lateral meniscus, and this is the medial meniscus. So they are C-shaped rings of fibrocartilage. Now, there's many types of meniscus problems. You can have longitudinal, vertical, or horizontal tears. You can also have meniscal cysts. But one of the most common types of meniscal injuries is a degenerative meniscus. Just know that these menisci are made of the same type of cartilage that you have in the intervertebral disc in your spine. So like the disc in your spine, they tend to wear out as you age. Now, most often we can treat these meniscal injuries successfully and you won't need to have surgery. The exception to this would be if your knee repeatedly locks or gives way. In this case, surgery can be a possibility for you. If we suspect you have a surgical problem, we will order an MRI and refer you to a surgeon if necessary. Now let's take a look at the examination of the knee for meniscal problem. Now I want to talk about examination and treatment of your knee problem. When you come into our office, we do a very thorough medical history, and we also do an orthopedic examination. We also, in most cases of knee problems, will order x-rays, and in some cases we'll be ordering MRIs. Now, if your problem is a meniscal problem, most often you're going to have pain in the joint line. Let me show you where that is. Okay, down here at my knee, on the sides of the kneecap, there's a little indentation on both sides of the kneecap. And if I press in there with a lot of pressure, usually with a meniscus problem, there will be some tenderness in that joint line. There's also specifically a few orthopedic tests that are very painful with a meniscus problem. So we'll be able to find those, discover those when you come in. Now, as far as treatment goes, let me talk to you about some of the things that we're going to do for treatment. Our treatment is biomechanical in nature. What that means is we are going to get your entire lower extremity, your ankle, knee, hip, and low back working correctly in proper balance, all the muscles functioning well. And in doing so, that will relieve the strain on your knee. Now understand that the knee is just a hinge joint. The ankle actually moves and the foot move a lot more than the knee, and the hip also moves a lot more than the knee, and that, the hip and the ankle and foot determine really what happens to the knee. So in order to be successful, we have to treat the entire lower extremity, and that is what we do. We use things like balance devices. This is called a Bosu ball here, and we do exercises on this. This is an unstable device, but this trains the muscles in your lower extremity to tighten at the right time. We also use balance devices like these balance sandals here. On the bottom there's a half of a ball, and we have you walk on this, and this trains your ankle, foot, knee, and hip to work better. We also use a thing called Kinesiology Tape. You may have seen many
Olympic and other types of athletes using this type of tape. We can tape your knee in a way that takes the strain off your knee. In some cases of meniscal lesions, we'll use deep massage. And this tool in particular can get right in there on that joint line. It's got a little point to it. It gets right in there in that joint line, and it brings more blood flow to a degenerative meniscus. It's very effective for that purpose. Of course, we also use physical therapy techniques like electrical stim, ice, massage, and heat as well. And sometimes we use nutrition for the knee to build back some of the structures in the knee, especially if you have arthritis or, in this case, a meniscal problem. So that's what we do for the knee in treatment. So I hope you've gotten a lot out of this video. If you have any questions, please don't hesitate to contact me. Thanks for watching.